Hi, I'm Alice Clifford. I'm the RN Medical Director at Pathway to Possible in Newton, and I'm sitting here with Sunny.
Hi, my name is Chandler. I'm one of the emergency room physicians at Milford Regional Hospital. I'm happy to be here with Alice today to talk about COVID-19 and all the good work they're doing at Pathway to Possible.
Hi, Sunny. It's so nice to sit with you today and be able to, as a nurse, speak with an emergency room physician about COVID-19 and your experience with it in the front lines. So we appreciate your service to the communities. And I'd love to hear more about what your experience was back in March when things really came to a head here in Massachusetts.
Thanks, Alice. It's a pleasure to be here. So back in March, everything was brand new and there was not a lot of information out there in regards to the COVID-19 virus. So there was a lot of fear and anxiety in regards to treating patients without the appropriate equipment, keeping people confident about how they would be best able to take care of these patients. It was definitely challenging to work through all that in March and April. And I think a lot of it had to do with lack of equipment and lack of knowledge at that point.
We were dealing with the same kinds of things, obviously on a smaller scale. We didn't have equipment on the ready for this kind of thing. We needed to order masks and get ahead of that as we saw it coming. But there's some time where you think, is this real? Is this going to be a problem, or is this just sort of some hype? But we got ready anyway. We decided let's just assume the worst and hope that we have some equipment that we never use. So we went for that. I'm wondering about the patients you saw initially. Did you have people coming in that were terribly ill? Did you see the broad spectrum of symptoms that were out there?
Yeah, so I work at Milford Regional Hospital, and to date we've diagnosed, I think, roughly 800 patients
Oh boy.
who have been positive with COVID-19. We've had, unfortunately, roughly 50 people die from the disease. When patients came in March and April, they were pretty sick. So the standard symptom kind of complex would be fever, coughing, and a lot of shortness of breath. And a lot of anxiety, because again, the same anxiety that we felt within the medical community was being felt by each and every one of us, not knowing what to expect. So there was that was definitely part of the symptom complex, was just a lot of anxiety, shortness of breath, fever, and cough. Most of the people, luckily, that we took care of were walking well. You would reassure them. You would give patients instructions to self-isolate at home and quarantine at home. Give them instructions about how to clean their high-touch surface areas and wash their hands and not go out into the public. Some patients we would have to admit to the hospital because they were having inordinate amount of shortness of breath and you wanted to support them. We didn't have a lot of therapeutics at that time, so it was really just giving them oxygen, intravenous hydration, and trying to support them through the whole healing process. And then, unfortunately, I did take care of a number of people that I did need to admit to the intensive care unit, and a number of people who died in the emergency room as well as a result of COVID-19. So we did see the full spectrum of disease in our emergency room, and still do.
Did you find that people waited too long to come into the hospital?
So I think that people actually came too quick.
Oh.
Because there was most of the people we took care of were people that could safely have isolated at home. If you remember, at that time, there wasn't even adequate testing. So a lot of times we would take care of these patients and say, yes, I think you have COVID-19, but I don't have any ability to test you for it. I also think that the one thing that was really amazing to see is how rapid people deteriorated. There was one shift I worked where one patient I thought was going to safely be admitted to the floor, and within an hour had full respiratory distress, needed to be intubated. And when I had initially walked in, he was talking to me, and he was conversing with me, and he had normal vital signs. And then an hour to an hour and a half later, it was a completely different picture. So it's hard to kind of predict too early or too late. I do know that we took care of a lot of worried people, though.
We were back in March again. We were getting ready. We were trying to keep staff calm. We were trying to keep each other calm. We met sometimes twice a day as a leadership team to talk about ideas and thoughts, and we were picking the brains of other agencies to see what they were doing. I have contacts in agencies that are much larger with thousands of staff and thousands of clients. So we were trying to see what are you doing, and how are you doing it, and how is it working, and that kind of thing. It was a scary time, obviously, but we were lucky in that we got equipment in, and we initiated using it earlier than the state asked us to. I just remember thinking, we own these masks, why aren't we using them? Let's start. And I was very grateful that, on a Friday we agreed, yes, let's have the staff start wearing masks on this day. And within a week, we had 2 staff come down with COVID, and they had been wearing masks at work. And because they were positive and had potentially exposed our clients, we had everyone tested. That was a potential, including staff that worked the same shift, and we had no positive results in the group homes. And we've been fortunate that has remained true all along. We've had a couple of staff come down since then, a slow trickle, and nobody symptomatic, just they took a test, or they found that they were exposed somewhere and took a test because they had been exposed, and they learned, yep, I have it. And again, we went on the same track with testing people, and getting everyone. For a while there, the state was sending out Fallon ambulance to the homes, the group homes, and we could get testing right on site, and that was great because they had each other, and then the staff could come too. So that worked out really well. So mask wearing has been really a savior, I think for us. What is your experience with the masks? What's your confidence level, I guess, with the masks?
Yeah, so I think, you raise a lot of really good points. I think that the first thing you were talking about is being able to reach out to other organizations and see what they're doing. I think that was super important, even amongst the hospitals. We reached out to our partners at UMass and Brigham and Women's. And with these associations, locally, the Brigham MGH system has been doing amazing work and research in regards to this. And it became very clear from international data as well as data coming out of Boston that the asymptomatic rate, people who have COVID-19 without any symptoms, is running between 40 and 45%. That's amazing because, 40 to 45%, it's like one of us may have COVID sitting down right here without any symptoms at all. So given that, it became very clear that masks are important because it's an important point of stopping the disease at the source. By wearing a mask, I'm not spreading the virus out into the environment. We know that you can be 6 feet apart in an outdoor setting because we know that the virus tends to kind of fall to the ground. We also know that the virus aerosolizes. So if you're in an indoor setting, it doesn't necessarily need to fall to the ground. It can kind of linger in the air for a while. And because of that, the mask is really important for, one, preventing spreading the disease if you have it, and 2, it prevents you from breathing in the virus. There's a lot of things you've all probably heard about what type of masks. It's clear that, a mask should be 2 layers as opposed to 1. A 3-layer mask is better than a 2-layer mask. The masks that you see people wearing with a valve, they don't work because they let in the particle.
I wondered about that.
Yeah, and then bandanas are not useful. And the gaiters that people wear are not useful. They don't serve too much protection. So, and in regards to masks, they have been shown to reduce transmission up to 6 times. So are they effective? Absolutely. It's probably the number one thing we can do to prevent the spread of the ongoing spread of this pandemic.
It's something I've been working with for staff a lot too, to keep the mask over your nose. You're not wearing a mask if it's not over your nose, and people get comfortable. I've been telling staff, assume your coworker has an asymptomatic case of COVID, and you want to protect yourself. So remind people, pull that mask up, and wipe down the surfaces. Assume that there's an exposure, and when you get that phone call that a coworker has tested positive, you want to think back and say, well, I had my mask on appropriately. I washed my hands many, many times during that shift, and I wiped down the surfaces, the common surfaces, and so you have a better feeling about what your test is going to look like when you know you have good habits.
Yes.
So that's been an ongoing topic of conversation, but it's been 6 months of this, of me saying the same thing over and over again and trying to hit it home. I have noticed in the statistics for the state in the past week or two, the numbers have floated up a little bit. And I've also been letting staff know this is not going away. We may only be halfway through this, so you can't let your guard down now. We've put a lot of work into staying healthy, and I can't let them let COVID exhaustion sabotage all our efforts. I don't know if you know this, but in the beginning we quarantined all of our homes for a month, meaning that we had the same staff move in and stay there, most for just a week or two. Some staff stayed for a month, so that they were there all day, every day for 4 weeks, to lower the spread of the virus and take away almost all the exposure that our clients may have had during the worst, during April, during the surge. Yeah. It was a tremendous effort on the leadership team's plate to encourage staff that we could keep them safe, that they would be in good hands with us, and that they could, kind of make it as fun as they could. And they did. I think it was a real success, and I'm really proud of the agency for doing that. I'm not aware of any other agency that was able to pull something like that together in such a short time.
Yeah, you guys are doing amazing. You haven't had even one case.
No, we haven't.
Which again belies that if you do the right things, if you physically distance, if you wear a mask, if you wash your hands, and when you wash your hands, you're washing them 5 to 10 times a day for 20 seconds at a time, you can prevent this. You can prevent the spread. And I know we can do this because we do this in the hospital, where it's very hard to physically distance in a hospital. We're caring for people. We have to be up there close. But we wash our hands, we use our PPE, we wear our masks, and luckily we've had several cases in the hospital, but no one's been sick from COVID-19 at the hospital. So we know these simple measures work. Quarantine fatigue, COVID fatigue, whatever you call it, it's a real thing. People we're all creatures of habit. We want to go out and enjoy our favorite restaurant and go to the movie theater and go to a sporting arena or go listen to some live music. We all miss those things. And it has been 6 months. It's been very long. But this is not a sprint. It's a marathon. We're not close to getting out of this. It's going to still be, like you said, halfway. I hope we're halfway. I hope we're halfway. It could even be longer. We don't know that. So good habits are important. And then ways to, we still have to be intentional. When we go to a store, we have to, be careful of what we touch. We have to be wary. We have to use our alcohol sanitizers when we come out of the store. Those are all important habits that we need now and probably for the next 6 months.
What are your thoughts about the numbers floating up in Massachusetts at this time? Did you expect that?
I did. There was always this expectation that once the college kids came back to town, once schools started in some districts, that 3 to 4 weeks later we would see an uptick in cases. The other thing is that getting back to the quarantine fatigue, when you look at the cases in the preceding 2 weeks in Massachusetts, you're twice as likely to have gone into a indoor restaurant setting than not. So we're also, I think it's the fatigue is setting in, we're breaking our good habits, the kids have come into town, and now with the influenza season upon us, we expect that there's going to be like a co-infection situation that's going to arise, and the cases are going to go up. This year, out of any year, I think it's very, very important that everybody gets their influenza vaccination. 100%, it should be mandated for everyone if it were up to me.
If you were to, I've understood that there's been some sort of suggestion that waiting until October might be smarter for the flu shot. Is that true?
I just got mine 4 days ago.
Okay.
I think the sooner you can get it, the better it is.
Okay.
It's going to be the same vaccine now. Why not start building up that immunity now?
Okay.
Yeah.
And speaking of only being halfway, which is painful to say out loud and painful for me to hear it from you, the holidays are coming, and we have clients who would typically spend the holidays at home, and this year it's going to be hard to let them go or to put a stamp of approval on that because of the amount of exposure from both sides. We have families that have frail elders in their home, and we have frail elders in our homes. So there's a cross contamination that's a real worry. What would you think about people taking this this one holiday season a little bit slower and letting us celebrate in the group homes as best we can? And we can do a good job celebrating in the group homes.
Yeah, I think that this is something that's coming up. I had a conversation with my wife Christina this morning about Thanksgiving and what Thanksgiving was going to look like. And at this point, it's really hard to know. If the amount of virus in the community is high, it's not a good idea to be intermingling. It just isn't. And
even with family.
Even with family. I think that this Halloween, this Thanksgiving, this Christmas, it's going to look a little bit different. And for one season, I think that's okay. In saying that, I think that people are with the fatigue, some people are going to do what they do. So doing things smartly would be the next thing. So like this whole concept of harm reduction, right? So, I can't prevent you from going, but if you go, try to stay outside. Maybe we were talking about like having a heat lamp outside, or wear a mask. Be really good about wearing a mask. Make sure you're washing your surfaces and make sure you're washing your hands. So there are ways that you can mitigate the risk, but obviously the safest thing would be to quarantine and not expose yourself to that environment.
Yeah, it's a tough pill to swallow. It certainly is, and it's difficult to explain to clients why it's better if they're home when certainly their habit is to be home for Thanksgiving. But we want to be careful of everyone, and it's an ongoing conversation we're having with the leadership team around how best to serve and protect our clients. We also want them to be happy and joyful, and enjoy the things that they enjoy, and they enjoy their families. So hopefully we'll have some creative ideas about how to get people together in a way that they can celebrate with each other in an open air setting.
So the people, again, that we know who's at risk for developing this disease. 70% of the people who've contracted COVID-19 have been over the age of 70. People who have underlying heart issues, lung issues, diabetic, or if their if their BMI is high, those are the people who have a higher incidence of developing this disease. When you talk about individuals who have physical and cognitive impairments, they're also at increased risk for developing this disease because, one, they could potentially not understand why do they have to wear a mask, or they may not be able to comply with that. Two, it's more difficult for them to physically distance from each other. Like you're caring for them. You have to be in there. You can't let them alone. And three, they may have symptoms and they may not be able to communicate that to you. So the clients that you serve are part of that high-risk population that we need to be concerned about. So again, I think that whatever we can do to reduce their exposure probably makes the most sense, but we're not going to be able to kind of do it for everyone all the time. So in that group of people, I think we just have to counsel, caution, and do whatever you can do to mitigate the exposure.
We have an amazing, an amazing supportive family team that's been very grateful and very much on board with all the decisions that we've had to make, uncomfortable decisions about visitation and that kind of thing. They've expressed their disappointment, but they just feel like, we get it, and we're going to support you because what we've done so far has been so successful. You can't argue with success, I guess.
Yeah.
On another topic, I'm wondering about the folks that you've seen in the hospital. When we had a little pre-chat, you mentioned that you had fewer ventilated patients. Do you think that the fewer ventilated patients means that people are being more careful? The people that might end up on a vent are smarter. They're staying home. They get it. They're being more cautious. So therefore, you have fewer ventilated patients.
So when the pandemic started, I don't know if you're familiar with that concept of the R naught. The R naught value for this virus was roughly 5, meaning that if I had the disease, I would spread it on average to 5 people. Each one of those people would spread it to another average of 5. So it would go 5, 25, 125, 625, and that's how this pandemic evolved. Right now, Massachusetts R naught value is 1.14, meaning that we've done an amazing job by this. But for a pandemic to stop, you have to get that number down less than 1, because that means if I'm spreading it to 0.9 and that continues, then the pandemic will die out. And that's why things like the contact tracing program are really important, because if you're able to get a positive test and isolate people, all of a sudden those people are not spreading the disease further. So that's one reason why we're seeing less people in the intensive care unit and less people in the hospital, is because I think in general in Massachusetts we've been doing a really good job. Again, as the numbers rise, which everybody expects will rise, I'm sure we'll start to see more sick people, and we'll see more people, needing ventilation in the ICU. I did want to go back to the concept of visitation. I think that the number 65% of the people who've died in Massachusetts have been a nursing home resident, which is unbelievable. And I think there are going to be a lot of lessons learned in terms of how do we structure a nursing home environment. I think the idea of having two people in one room is going to go away. I think that, I was talking to Brenda earlier, and she was saying that the biggest home is with 8 clients, which is amazing. The current recommendations are going to be between 12 and 16 clients in a group setting. So you guys are already, doing well with that. There's going to be increased focus on filtering systems within group homes and nursing homes. There's going to be they're going to start using copper on surfaces because it's antimicrobial. And then getting to the visitation piece of it, one of the things I was reading about is that some nursing homes are setting up clean rooms where there are 2 entrances to a room, and it's separated by a plastic wall, so that you can see your loved one across the room, but they're not exposing each other on either side, and there's a separate egress for them to come and go.
Oh.
So there's going to be, there are going to be a lot of lessons learned from this pandemic, and this is horrible right now, but I think that we'll all be better for it down the line.
I wanted to learn more about the change in therapeutics from the beginning to now as far as treatments in the hospital. We've learned so much in a short period of time.
Yeah, the pace of the science and the pace of the literature coming out has been incredible with this. So initially, again, going back to April and May, the only way we could get patients through this is by supportive care. Making sure they had enough oxygen, making sure they had intravenous hydration, maybe supporting their blood pressure a little bit, and then kind of throwing the kitchen sink at them to see what worked. But now we have a little bit more information. So, for instance, dexamethasone, which is a steroid that's easily available, has been shown to reduce mortality and length of stay in the hospital. There's a medication called remdesivir that has been helpful as well.
That's an antiviral?
It's an antiviral medication that has been shown to reduce hospitalizations from 15 days to 11 days. So another benefit.
What's the dexamethasone affecting? Is it lungs?
It's lungs. It's an anti-inflammatory medication. Initially, the thought was steroids would actually increase the severity of disease because steroids in general lower your immune system.
Oh.
But the anti-inflammatory property is more beneficial to patients.
So they're given together.
So this is the tricky thing. So we talk about the remdesivir, the dexamethasone, convalescent plasma. They all have little benefits, but together there is a benefit, and you are about 30 to 50% less likely to die from COVID-19 today than you were in April and May.
That's very encouraging.
Yeah.
It's very encouraging.
No, the science has been so fast with this. Again, looking at literature from Italy, from Spain, from China, and then all the literature that we got from New York has been very helpful in kind of the evolving nature of treatment. And the vaccine development has been unbelievably rapid too. I know it may seem that it's taking forever for a vaccine to be developed, but the average vaccine takes 10 years to develop. And we're talking about a possible vaccine that's going to be ready in less than 1 year from the time this was, discovered in December of 2019. That's unbelievable, unbelievably fast. So the science has been great on the therapeutic front, and it's been great on the vaccine development front as well.
Does it make you worried that it's been rushed, the vaccine?
So I don't think rushed is the right word. Okay. I think that they've been doing a lot of things in parallel, In general, when you develop a vaccine, you do things, you finish one thing, then you go to the next, then you go to the next. They've been doing everything at the same time. In fact, there's actually vaccine being produced right now. They're going to have, one of the vaccines is going to have 100 million doses ready without even knowing whether the vaccine works or not. So there's just a lot of things being done in parallel, which has helped kind of speed up this vaccine development. They're also using new technologies that have not been used in previous vaccine developments. Moderna, specifically, is using a new way of creating a vaccine. So the science piece of this is super exciting and fast. But again, things are just seeming so slow, and we just had to be patient.
On the day-to-day, it certainly seems slow, but when you
Right.
think about a vaccine that could usually take 10 years being available in a year from the initial onset of the virus, that's tremendous.
It's amazing, yeah.
It's tremendous.
So once the vaccine, and I think I'm very, I think I'm confident, listening to Dr. Fauci, he's pretty confident that we're going to have answers about vaccine yes versus vaccine no by the end of this year. And then I think that the vaccines will obviously be put out to the public in a strategic manner. I think that we'll probably end up vaccinating the highest risk populations first.
The
and then
nursing home clients.
the nursing home clients, frontline providers, and then we'll go from there. It may take some time for all of us to get the vaccine. And in fact, our kids may not get the vaccine until next year, a year from now.
But that's fine, because we're tumbling sort of in the right direction, and there's an end in sight, and that's what everyone's looking for at this point. And when is this going to end?
Yeah.
That's the sort of the light at the end of the tunnel.
Yes.
That's what we need to see.
Yes. Yeah. Yeah, I think that there is a light at the end of the tunnel. I think that, again, there are going to be a lot of good lessons learned to hopefully mitigate something this from happening again. I think that there's been a light shined on the fact that there's many social determinants of health that we can potentially make more equitable for people. I think that if you look at the African American, Latinx, indigenous peoples, they are 2 to 2.5 times likely to contract and die from COVID-19. I think we have to do something about that. I think that, physically and cognitively challenged people are also at risk, more at risk than the general population. I think we need to do something about that. I think that, we are all in this together, and I like to use the term physical distancing now, because remember, it used to be social distancing, but we shouldn't be socially distancing. The loneliness is on the rise, and I think we need to, be better members of our family and our community, and reach out to our neighbors and make sure people are doing okay. And I think we'll get through this.
For the most part, I have to say that people have really done well in our homes with working with staff who are dedicated to them. I think our staff are 1 in a million. I'm sure that in the hospital you feel very proud of your team. These are folks that are giving direct care to people that aren't their loved ones every day, and it's really been a really bright light in all of this chaos, all this unknown. So I'm really proud of our staff.
I'm definitely humbled by the work that our nursing staff has done, and I'm humbled by people like you who are doing such great work in the community.
Oh, thank you, and you. It's been a really hard time to be a nurse and a hard time to be a physician, that's for sure.
Yeah.